more difficult case, and this is also a patient from a study that we have recently finished. And here you have a young patient which was diagnosed with MIH that also affected both central incisors. So here you see the baseline findings of this case, and you see you have lots of different light distribution during the teeth. You see some very opaque areas, some less opaque areas, and also you see a mixture of both even in one tooth. So in this young patients, you cannot do any kind of veneering prosthetic procedure because they're still growing. The teeth are not fully erupted yet. And when it comes to teeth with this kind of discolorations, because as we all know, ICAM is not changing the color, it's just changing the light refractive pattern of the enamel. If you need to change the color, you should bleach before. We got already rid of the chronic discoloration, so the precondition for the treatment have been made very well. And if you bleach before, you should have a washout period of 2 weeks between the bleaching and the infiltration treatment. And then in the first step, the teeth were dried and the surface in this case was pre-treated using a polishing disc with medium grit. Because if you etch for too many cycles, you may also etch too much of the surrounding enamel. That in particular in these cases where you don't have much structure left should be avoided. So it was chosen to use this abrasive disc, and you can see here that the light distribution pattern of this lesion has already changed just by removing the top of the surface. And if you use something that is not initiating the polymerization of your infiltrant, you can control every step of the procedure. So to answer your question, that's the security that you get using this technique. And then the classic procedure was performed, etching, 3 minutes, the lesions were dried. This is the chalky appearance of the one etching cycle. Here, then the infiltration was performed, and you see very well how the infiltration was fully infiltrated. And in this corner, a little layer of composite was applied to even out the fractious areas of the tooth.
오리지널로 보니까 많이 다르네요.
네.
너무 케이스가 훌륭하십니다.
질문이 하나 더 있는데 지금 저 표면에 이렇게 염산을 올려놓고 이걸 문지르는 거를 하시나요? 아니면 그냥 얹어만 놓나요?
I rub it in the beginning and then I just leave it on the surface because I think rubbing doesn't help much for the hydrochloric acids, which is also self-limiting.
블리칭 하시고 난 다음에 집에서 하고 와서 최종적으로 클리닉에서 이거를 치료를 저렇게 이제 한 6cm 정도 되는 것 같은데 치료를 하는데 어느 정도 시간이 걸리는지요?
It depends. I think you can achieve something like this maybe in 20-30 minutes if you bleach before.
60 total is 30 minutes?
Yeah.
Okay.
If you have a proper pre-treatment protocol, you can be faster.
How many cycles did you that case?
Only one.
Just
Etching,
one?
you mean? Yeah.
Okay.
That's why we use the abrasive disc. Because if you see you have such a thick surface layer, it doesn't make sense to etch and etch and etch. Just remove it and.
뭔가 지금까지 우리가 잘못 쓰고 있었던 것 같아요. 제대로 배우고 쓰면 좀 더 효율적으로 쓸 수 있을 것 같아요.
나 그죠. 네. 제가 설명서에서 봤을 때는 완전한 그 초키 에어리어가 생기지 않으면은 그 애칭을 2번 내지 3번 반복할 수 있다라고 되어 있었는데 말씀하시기로는 한 번만 한다고 그러는데 모든 케이스에서 한 번만 하시는 건지.
I say I use like individual protocol for all cases because these lesions, they are so heterogeneous that you need to work step by step. But in this case, we were able to remove much of the surface layer, so one etching cycle was enough, but I have also cases that I do 2. But usually I would always go for a little micro abrasion then.
질문이 하나 더 있는데
We have many questions.
I mean, that's why I'm here.
yeah.
I don't
지금
mind.
이렇게 필링을 해야 될 케이스에서는 이게 먼저 이렇게 아이콘을 다 쓰고 그리고 나서 필링을 하는지 아니면 필링을 먼저 하고 아이콘을 쓰는지 이게 순서가 되게 중요할 것 같아서 한 번 더 정리해 주시면 좋겠습니다.
Yes, it's use icon first, infiltrate the lesions, get like light distribution, aesthetics in place, and then you just add the composite in places where you need it.
Beautiful. Beautiful. Yeah.
수가가 어떻게 되는지.
Germany, well, I would charge probably 600 for the whole year.
원투스와
No, from 3 to 3, 600.
리저너블 프라이스. 개인적으로 아이콘을 쓰는 게 그냥 일반 레진을 하는 거에서는 시간도 많이 걸리고 좀 신경을 많이 써야 되는 부분이기 때문에 비용을 좀 많이 받는 게 좋다고 생각을 합니다.
I agree with you.
이렇게
지금까지 아이콘으로 치료한 케이스가 한 몇 케이스 정도 되시는지 궁금해요.
I never counted them. Maybe more than 100.
I have one more question. Maybe
Okay.
it's the last.
Feel free.
한번 해가지고 시간이 너무 오래 걸렸는데 결국에는 완벽하지 않은 상태로 환자가 일단 한번 가고 그러면 또 다시 재방문을 해가지고 재치료가 가능한 술식인지.
I mean, after you have performed the icon treatment and the outcome was not what you expected and what your patient expected, I think you can do a retreatment, in particular if there is some like whitish area remaining, but you need to mechanically remove the first surface layer. But if you work with trans-illumination, it won't happen. And maybe one thing that I should add here that of course is important for every kind of lesion that you treat, you should start the infiltration process, of course, after the drying step. So you have that chalky area, you see it very clearly, and then when you place your drying agent on top, it should disappear. So you should see it diminishing, and when this visual check is successful, then you can start with the infiltration. So you have 2 means of control, a very visual and also one light dependent.
참 도움이 많이 되는 얘기인 것 같습니다.
초반에 표면을 이렇게 처리하는 거랑 그 다음에 저렇게 좀 변색이 많이 되어 있는 케이스는
미리 블리칭
미백을 한다는 거는 지금 이 설명서에 없는 내용이고 아마 이 제품이 개발되고 나서 뭔가 업데이트된 내용이고 최신 내용인 것 같습니다. 그래서 그런 내용들을 좀 오늘 알려드리게 돼서 되게 의미가 있는 것 같습니다.
저는 저 케이스 너무 멋진 케이스여가지고서는 저 환자한테 저런 상황에서 우리가 보통 할 수 있는 거는 저는 딱 비니어 아니면은 이제 레진 이 정도로 생각을 하는데 저 환자의 치주도 살려줄 수 있으면서 아직 완전 맹출되지 않은 치아를 저렇게 보존할 수 있는 술식, 그러면서도 저렇게 아름다운 결과를 가질 수 있다는 게 참 놀랍고, 이게 기술 발전되는 상황에서 우리가 뒤처지면 안 되겠다, 이런 신기술이 있고 새로운 제품들이 있는데 그냥 기존의 것들만 이제 생각하면서 우리의 트리트먼트 옵션을 이렇게 좁힐 필요가 없겠다, 이런 생각이 들었습니다. 저건 정말 멋지네요. Thank you very much. Thank you very much.
Thank you.
Beautiful case. Thank you very much. 네.
네. 자, 이상으로 정말 좋은 케이스 보여주신 닥터 수잔나, 너무 좋은 시간이었습니다. 너무 감사합니다.
저희 박수 한번.
다음에 또 더 좋은 콘텐츠로 찾아뵙도록 하겠습니다.